I'd like to call this meeting to order and do a roll call.
Okay, Dutchess County, Nicholas Trio, present. Dave Violante.
Here.
Joan Siebert.
Here.
Tim Murphy. Dee Sagendorf.
Here.
Pete Chanella. Guy Carpicio. Orange County, Joan Cheney. Ben Conquest.
Here.
David Grass.
Here.
Israel Knobloch. Terry Barbie. Frank Kasnight. Michael Bigg.
Here.
Putnam County, Robert Cuomo.
Here.
David Jacobson. Matthew Bondi.
Here.
Okay, Rockland County. Kim Lippis.
Here.
Nick Rusieski.
Here.
Tim Egan.
Here.
Desiree yes, Leon. Sorry, it's written over with red ink. Glenn Albin.
Present.
Teresa Hamilton.
Here.
Neil Dayan. B.J. Leidner.
Here.
Sullivan County. Avi Bachman. Greg Tavermina. Neil Medoff.
Here.
Heidi Stack. Mike Bruce. Mark Strauss. Ulster County, Richard Parrish.
Here.
Kelly Nelson.
Here.
Dorothy Balin. Timothy Mitzel. Lisa Servina. We have 18.
18, sounds good. All right, before we go much further, I'd like to have a moment of silence in memory of Frank DiGianni. Thank you. And I have some letters to read in. All right. From Rockland County EMS, please let this letter serve as the resignation of Rockland County alternate delegate Deb Stewart. She has notified the office that she wishes to resign effective immediately. Neil Dahan will be filling the vacant alternate seat for the remainder of the term. His contact information is as follows. And another one from Rockland County. Please let this letter serve as a resignation of Rockland County alternate delegate Bernice Garatti. She has notified the office that she wishes to resign effective immediately. Teresa Hamilton will be filling the vacant alternate seat for the remainder of the term. Her contact information is as follows. And just to confirm, Tim Egan will be replacing the unexpired seat of Mike Murphy, who has retired and left the area. Ulster County EMS Council, with regard to our expiring alternate delegate, the Ulster County representation on the Regional Council, Timothy Mitzel, will take the spot of Richard Mullally. And do we need to vote on those? As accepting them?
I believe so.
I just need a motion to accept them.
Motion to accept?
Second.
Second. All in favor?
Aye.
Okay. That way they can vote tonight if they're here and show that Dot Balin has arrived from Ulster County.
Okay.
All right? And really good news, and I think he got his earful today, but I am pleased to confirm to Dave Violante, pleased to confirm your appointment to New York State Emergency Medical Services Council representing the Hudson Valley REMSCO with your term ending December 31st, 2019. Thank you for your willingness to serve on the SEMSCO. I look forward to working with you in this important role. Additional information will be sent to you about your membership in the near future. Should you have any questions, please feel free to contact Valerie Azaga, Executive Secretary. That's good news.
Congratulations.
How painful was it, Dave?
Yeah, well, I've got 8 pages of notes that I'm writing later, so.
Yeah, it was an interesting 2 days in Albany. All right, so that was pretty much my report. Treasurer's report.
We wrote 57 checks totaling $66,900. Rent and health insurance are always our top expenses. If anyone wants to see the details, please see me or Bill. We transferred $30,000 to payroll. We got our fourth quarter program agency voucher payment ending for 6/30/2018, which was $64,592. The first quarter council ending 6/30/2018 is billed and paid. We've got another $7,500 for our AMPAR grant. And we've had $9,000 in this escrow money we took in for CONs that, based on what goes on in hearings, some of it's cut back to the contributor of the CON fees. Our balance, our total assets are $217,161. What's that?
Motion to accept that.
Yeah, need a motion to accept the treasurer's report? Any,
Second?
no discussion? All in favor?
Aye.
Staff?
Okay, we have spent a substantial amount of time on CON actions this last quarter. Since I've been here, we've had 5 in total, and so far in the last 3 months, we've had 5. So it's been very hectic, so a lot of our time went there. But we also did wrap up our contract year. The June was the end of the contract year for the program agency, and it was actually May is the end of the quarter for the end of the year for the council. But that's all wrapped up, and as Nick said, we submitted all the paperwork and everything has been paid on that. We did have a couple of extra meetings. We had a special HVREMSCO meeting, which most of you are here for. I did have a conference call with the new new director of the Bureau of EMS, Brian Greenberg. And there was a bunch of changes up in Albany. A lot of people left, and there's some issues with that, where the paperwork goes and who gets what and stuff like that. They're supposed to send us down a list of where all that paperwork is going and how it's going to be distributed. I have not gotten that list as of yet. I do have another conference call on next Wednesday with him, so we'll see if we can get that finalized. Also, each region is going to get a dedicated representative where we will work with that person to get what we need at Albany. So the Bureau of EMS is recognizing program agencies and councils a lot more than it was in the past, and they're going to be asking us to do a little bit more work on different things and get some additional feedback from us. So I think we're going to be playing a little bit of a bigger part in what the state is thinking that we should be doing. The AMT reimbursement is being looked at. It's right now at $530. There's a lot of issues, or a lot of people complaining that it doesn't cover particularly the cost of the materials that you need to train an AMT. So they're looking into that as a reimbursement. Back a while ago, it was announced about the CME program being cut back, number of CMEs. That has been looked at, and it's in process, but it probably won't happen until the 1st of this year. So anybody that's renewing this year needs to do all their CMEs that CME hours that they have been scheduled for. Okay? The Ryan Greenberg is very interested in electronic PCRs, and he wants to try to move all agencies somehow in the state to electronic PCRs, which is something that we've been trying to do for a long time. So I think you're going to see some efforts there. I don't know if we'll see any financial support on it, but he is trying to do that. He's trying to also look at the credentialing process. The credentialing process in each region is very different. How we credential our providers, our ALS providers, is different than any other region. Some regions just say, yeah, you're a paramedic, here's your card, and you're credentialed in that region. Some regions actually credential BLS providers, and so he's trying to consolidate that and to get something pretty much similar across the state with it. He's also doing the same thing with the QAQI programs. So he's been asking a lot of us, what do we do for QAQI? How do we look at it? What in particular do we find? And he's also looking to set up some standards on that. So that was kind of going to see a lot of changes coming down, I think, in that aspect of things. We did have an RTAC meeting. I can't think of anything that was significant at it, so I'm going to pass on that one. I just can't think of anything else. And well, several of us just got back today from the CMAC and SEMSCO meeting. So
This evening.
yeah. So, but that's about it. And I don't know if everybody's aware that Karen's out. She had surgery on her arm. I was talking to her today. She's doing very well, but she's still in a fair amount of pain. But she had surgery on her right elbow.
Any questions of Bill? If not, QAQI?
The project that's been eating up most of my time since the last meeting has been the move to the Nemesis 3.4 bridge. We are part of a group of regions that is doing the initial implementation and starting with image trends. Clients are moving them over to first our regional bridge and then to the state bridge. And what we have found are some issues with some of the rules, and that is taking some time to go back and fix. The nice part of it is the validation scores that we look at and try to figure out why some agencies are low and some are not. That's pretty much going to go away. If your data gets uploaded to the New York State side of the bridge, it means it had a validation score of 97 or greater. On the regional or local bridge, because of additional things that we may be asking that aren't necessarily a state or NEMSIS requirement, your validation score on that side may be a little bit lower, but it's easy for us to figure out why. And that's really not going to be a significant issue. So far, we have 4 agencies on our regional bridge, and the average validation score for the last month has been 100, which shows us that even the local rules that we have are appropriately written and applied. And the reason that we went to some additional rules was one of the last studies that we did, we had a lot of null values. Not reported, not applicable, not found. And if you're trying to glean something from the data, if you don't have data points to look at, the data is pretty worthless. So we opted to institute some rules that would kind of fix those loopholes. The current plan in place for migration for all agencies, we probably won't see everybody on the new bridge until sometime next year. They're going vendor by vendor and seeing if we have any problems with the software. Starting with image trends, simply because it's image trends bridge, and if we see a problem, it's going to be easier to track it down. We have seen some mapping issues. We'll start moving over other clients as the timetable allows, and as Peter pulls the trigger on it and says, we'll do this next batch. But it's going to be a slow, methodical process so that we don't miss anything.
Who's on it now?
On our bridge, we have Marbletown, Port Jervis, Esopus, and Olive First Aid.
And what was the last name?
Olive. And it's been a process to get them on because it's not simply a flip of the switch. There is some work on Image Trend side, and their implementation people have been working with us. We typically have at least one conference call every couple of weeks for a good hour, hour and a half, and that's throughout the state, so that if somebody is finding an issue with the rule, we can look at it right then and there and see if, number one, if the rule is actually valid. And we can also take a look and see where the mistake may lie. And a lot of times, it's simply the placement of a set of parentheses. So it's fairly easy to figure out once you're looking at it. And the other thing is we have to try all these rules to make sure that they do work. So that takes a fair amount of time and effort because a lot of these are dummy cases that we have to send and then get rid of because you can't have that in the real data set. And that's really been about it.
Any other questions of Jeff? If not, okay. Dr. Papish, continue.
I don't have much for you guys. We haven't met in... When was our last meeting? I can't even remember it. I don't know. Everything's been pretty senescent over the summer, and so as a result, I really don't have any report. CMAP just ended.
Yep.
Yeah. October 1st is the next REMAC meeting.
Next meeting, we'll hopefully have some news for you.
Okay. Training committee, Dave?
We are doing a CLI on November 30th, December 1st and 8th. Those are the class dates. It'll be like an 8 to 4, 9 to 5, something. As soon as that gets finalized, we'll send that out. So that's for the CLI class. We are also doing a CIU on November 15th in the evening. We're going to hold it here and then also transmit it down to Rockland and up to Ulster County to Rich's Hospital and down to Tim's Place. And so we'll send that information out as well. You have to be present at one of those locations. We'll have CIC there at each location and the ability to sort of go back and forth. And so that fits in with some of the thoughts from the state level and what we're doing in training and ed and what we're doing in some other places in terms of meetings that you don't have to travel 3 hours for.
What date is that?
That's November 15th.
The dates of
Thursday.
the dates of the CLI, David?
November 30th, the Friday, December 1st, the Saturday, and December 8th, the following Saturday.
9 to 5.
And that'll be held at Dutchess Community College. We're still deciding whether it's going to end up being the South Campus or the North Campus. They have to let us know.
Any questions, Dave? Okay. All right, REMAC, can we pass that? And no update on protocols, right? Okay. Transportation committee. Now we'll...
Okay, under new business, we have second in motions coming up for Arlington permanent ALS FR operating certificate, town tax, EMS permanent BLS operating certificate.
I'm sorry, Glenn, say that again. There was too many letters. Sorry. The town of Patterson, what?
Town of Patterson EMS.
EMS, okay.
Permanent BLS operating certificate. You all should have received the results of the hearing officers on both of the agencies. I hope you took the time to read it. That'll make our vote a little bit easier. And we'll have that under new business.
Okay, any questions for Glenn? If not, Desiree's not here. Any update on public information education? If not, we're moving this right along for you,
Good,
Bob.
good.
All right. Policy and Procedure Committee, Greg, no
Here.
update. Legislative bylaws, Albie, nothing.
He said he'll double up at the next meeting.
Double up. All right. EPCR committee, any update on that? Nothing? All right. Who's taking the lead on the community paramedicine? That used to be Mike. Anybody got any updates on the community paramedicine? If not, you're thinking about it there, Tim?
Yeah, I can take it for you if you'd like. I mean, we're obviously doing a program, we're going to do another program.
Tim, you gotta keep your voice up for me, because I have the air over my head. You said
No
we're
problem.
obviously doing a program, and what?
We are, I listened to the last meeting's tape, and I know that Mike spoke about our current program, and we're going to be starting a new program with the other side of the county, probably the first of the year. So I'd be happy to participate or read that committee if you'd like.
It really wasn't the committee, it was Murph
Updates.
did the updates on it, because I guess he was pretty involved with it at the state level, so.
Well, there's nothing new on the state level that I'm aware of, unless something happened at SEMSCO
No.
in the last couple of days.
Nothing happened.
Nothing new legislatively, for sure. Nothing's going to happen until after the elections.
During, they did discuss the meeting, because they wanted, the governor's current budget has money in there for the community paramedicine should it go forward, and they wanted to make sure a request was made that it would push forward to next year.
Was there mention made of the governor putting in his budget for next year as a proposal again?
Well, that's what they're trying to do, they're trying to get it to push it
Okay,
forward.
good.
The same money that was not used this year, they want to push it forward. So I don't know what's going to happen,
Well,
but
we'll
they said
see
that
how
they
the
wanted.
House-
Guys, you have to talk one at a time. You cannot talk over each other like that, okay? Or none of it gets on the record. Everything you said is like
The
not there.
request was that the governor's money that was allocated for this year be pushed forward to next year. It's not a guarantee, it's a request that you do it.
Okay,
I think I did hear that Tim said that he would be back.
yeah, we'll put Tim down.
He's sitting in the back room, so he can see out the
All right, and Dave, you get to give your first council report.
There is a lot of stuff here. I'll try and go through it quickly, but comprehensively, a lot of stuff happened that everybody here should know about. There's a new initiative at the state level by EMSC, which is EMS for Children, in terms of pediatric preparedness. There's a lot of agencies that don't have pediatric training, pediatric equipment, retraining, annual training, and preparedness in pediatrics, and so the focus of that group is to try and improve pediatric preparedness across the state. So they're working on that. You'll hear more about that as it gets developed. In terms of training education, the Vital Signs Conference is coming up October 11 to 14, and there's going to be a NAMSE, N-A-M-S-E 2 course at Vital Signs this year. The instructor policy is being updated. It'll be out in the next few weeks. And that is going to be policy 1802, which will update policy 1603. They didn't give any information about what the updates are, but there will be updates to that. Bill talked about the CME update. In terms of the AEMT programs, there was a commonality in that the teaching of the program was much higher than what the national standards were for the program. And so it seems like a lot of people actually taught that program to the paramedic level in some areas, or the paramedic standards. And as such, people did fairly poorly on the exam. The exam is a validated exam by up to 2 to 5 items per question. The regional faculty and program coordinators that we had attempted to introduce a long time ago, they're still working on. Some of those individuals got letters saying that the state's working on it and they should have some answers near January. Tied to that, they also said that the regional faculty and program coordinators will no longer need approval from the local HVREMSCOs, because those personnel are going to be state positions. There's going to be a new process and manual by the state for those individuals as well. Not to slight this region in any way, shape, or form. Some of the reasons for that was because other regions were being political about their appointments instead of for other reasons. And so the state wanted to get around some of that. Course sponsor audits are ongoing throughout the state. Some of the answers right off the top are that students love their instructors, so you have to good work with that. The CME program content, however, there's a little bit of a problem with that. While they are intending to dial back some of the hours, what they're finding is that people are going to multi-level classes. So EMTs and paramedics are going to the same class, and either it's over the EMT's head or it's under the paramedic scope. And so they said, we really can't do that. If you're an EMT, you need to go to EMT level classes for the credit for those, and likewise for the paramedic on that side as well. Course sponsorships are actually considered on a per county level, and so if there's any thoughts of handshake agreements among course sponsors in a county, just realize that the course sponsorship has the county-wide ability, not just a particular small geographic area within a county. Statewide, there's a lack of CLI programs, and so they're really looking at distance learning and remote education to help with the CLI process. There is an online bridge program they have developed with Northwell Health for the CC2 paramedic. That'll be at the state level. It'll be completely and totally online. It's a 6-module program that will take 1 year to complete. If anybody wants any more information on that, let me know about that, and I'll give you that information, make that available. The 17-year-old capability for EMTs is still out. There was a problem with some of the process. It went back and forth at the state legislative level, and it is now has to go back out for comment before it can be then voted on. And that's training. From the Bureau, they have 3 meetings per year, and they've agreed to hold an additional committee meetings, so up to 6 committee meetings now will happen per year, with committee meetings happening in between the regularly scheduled CMAC meetings, and those can be by WebEx, phone conference, that kind of thing. So that's going to happen at the state level, which is good, so more can get done. They have a trauma report coming out in October, an opioid report coming out by the end of the year. Some leadership training going on from the state level. That's one of the things that they realized there was a necessity for out in the regions and local areas. So they're doing some of that. They are looking at statewide quality metrics via EPCR, and they talked a lot about standards of excellence, predominantly following the Virginia program. And so you'll see more coming out through EPCRs and need to move towards EPCRs to get statistical information, data, etc., gold standards across the state, and quality metrics. The Bureau is going to come out with a quarterly newsletter. One of the things that was talked about was increased communication. This is one way that they can provide a little bit better communication out to the regions and agencies. Bill talked about a bunch of staff changes up there, and we talked about vital signs.
Talked about what?
Vital Signs Conference. Okay, there's more. We did have a presentation by some folks at Wadsworth, and they talked about ambulance transfusion services and blood products during transports. Interfacility transports, there was a ton of discussion. That group regulates the industry of blood products everywhere, and so they're responsible for what happens with initiation of blood products. And so there was a very long process previously for applying to be an ACS, and that's a transport service that's authorized to use blood products. And this process has been going on since 2007 or 8, somewhere in there. So it's been ongoing. And so they came up with a much better process. That process still seems onerous, but they are willing to work with a collaborative group of physicians, EMS providers, hospitals, etc., to try and make it even more streamlined and try and address everybody's issues. That was a very lengthy discussion. I will say this group because I think it only affects a few agencies that we can talk about if need be at some other
Yeah,
level.
the contentious part is that, and they're claiming that a nurse, once she leaves the hospital, can't be on the ambulance as the person regulating the blood. It has to be a qualified critical care or paramedic. And during the CMAC session with all the physicians, it got very contentious. I felt sorry for the two ladies that were presenting. This morning when they presented, it was a lot better, but there's some issues that, and the rural parts of the state have a lot of concerns that they have to get an ATS service to transport a patient that has blood running. They're not available. So how are they going to get this person to move if a nurse can't go as the qualified person? And apparently somewhere in the standard it says that they can't do it. So they're going back and revisit it. So
You'll hear more about that as well.
I think the piece that needs to be added to this group, so you at least understand it, and what made so many long-tailed cats nervous in the room was they're now issuing violation letters to both the hospitals and the services that transport without these contracts in place. And there was a lot of contention to what does that mean? You're writing a letter of notice. Is it financial penalties? Is it agency violations? And there was a lot of shrugging of shoulders of possibly, could be, yes, which is what made the whole room get really anxious and upset that now all of a sudden, without any, because there's only 10 ETS services across the state that are qualified to do it. So you end up with a lot of rural facilities that now when do we violate EMTALA and not treat and transport these patients to proper care, or do we violate the state regulation that says bloods have to go with a certified provider? So
The answer to that from this group, from both CMAC and HVREMSCO, was to draft a letter to the commissioner urging him to form this committee of personnel in a collaborative way, and then not cause any kind of litigation, damages, or harm to providers, hospitals, agencies, and personnel who end up doing transports in the patient's best interest as a result. There's going to be a new designation of stroke centers, primary, thrombectomy, and large vessel. More information will be coming out about that. It'll be a 3-year certification as a stroke center in that particular designation. They will let us know what that means for us so that we know if we have to take a patient under what parameters to what particular center. In terms of the protocols, the protocol committee met, and there are some ALS changes, including nitrous oxide for pediatric patients, the removal of the need to dilute amiodarone in cardiac arrest situations. Ketorolac is a standing order. with a
Sorry, say
change.
that again, Dave. What was the
Yeah, I tried to slow it down.
That's okay. No, I didn't hear you.
Ketorolac.
Thanks.
In standing order with a change in the dose, cardioversion, dosing change, and the removal of McGill's at the AEMT level. They also wanted to strongly use waveform capnography for any kind of advanced airway. And so right now we just have it for intubations, but they're strongly urging people to use it in King airways and other supraglottic airways.
You're doing great.
How many pages is that, Steve?
8. Let's see. That one. Under the SEMSCO, the remainder of reports are put into here. The finance talked about budget motions with an operations budget of $6 million and an aid to localities of $14.5 million.
I lost you, Dave. The what localities?
Aid to localities of $14.5 million. This is a 20% increase over the last, I want to say it was 10 years?
10 years.
10 years for the budget, so that people here know the operations budget is $6 million and it can be spent at $6 million, but the aid to localities ends up having an amount that's capped that doesn't meet the maximum amount of the budget. And so they're not allowed to spend the whole budget when it comes down to it. So they made a motion and passed it to increase the budget of EMS and to be able to spend all of the monies in all of the areas.
Can I just interject on that? They made that motion and they passed it, but that doesn't mean that anybody is going to get the money.
Correct. That's right.
That still has to go to the Office of Budget, then they'll see if they pass it, it then is processed up through the governor's office, and then it has to come back down in the budget itself. And then when they get the budget, they put in this, what they call a ceiling, and that's as much as you can spend as to what they gave you. But we're the council here, and our office, the program agency office, is part of that aid to localities. And 1997 was the last time they increased any money coming to the council or to the program agencies. And they've at least doubled the deliverables that we have to do.
Under systems, they upheld a Wyoming Erie REMSCO action to deny Orchard Park Fire Department EMS to expand their operating territory. And they strongly suggested and reminded all agencies that they must have a mutual aid plan. It's not a one-way plan, it's a two-way plan. And that mutual aid plan must come to and be approved by the REMSCO. And so if there's a county that has a mutual aid plan that every agency is a part of, that's great. Make sure the REMSCO has it. If you're in a county that does not have a county-wide plan, you need to send your individual mutual aid policies to the region. That's a requirement of Article 30, I believe is where it's under. And so Kim's been talking about that for a long time. We need to make sure that we do that, and make sure everybody's here. Maybe that's something that if the office doesn't have that on file, they can reach out to the county coordinators to help facilitate that process. Under legislative, there are a couple of things that are out there. There's an EMS bill out in Nassau to halt private ambulance companies from going to calls. The SEMSCO opposed that bill, and that passed. To oppose the bill doesn't mean that it's legislatively not happening. It's just that they voted to oppose it. There's another one there's another one for counties to be able to get a CON for the county to operate at the county level.
That's only for Essex County.
That's only for Essex, right?
Yes.
And what they're hoping is that that'll help in the future to potentially open some doors for counties, but this one is particularly only for Essex. They did support that bill that was passed. There are a couple of others out there, a hold harmless if EMS personnel treat cats and dogs. That's a bill that's out there, not passed. Any of these are just bills. And there's a Jimmy's bill that will require insurance minimums for agencies. And the reason for that came up in that a child had to be transported by air. The ground provider dropped him off with the air providers. The air providers took the child. The ground providers left. There was a problem with the equipment that the child was on. They couldn't negotiate the equipment well. The child ended up dying, and the air provider did not have appropriate medical insurance or other kind of insurance, and so that's where that particular bill comes from. That one and the PET one was informational only. Those are public statements.
Bob had a question on why the Essex is different than a muni CON. Counties can't apply for a CON. That's why they need this law passed, so they can do a county-wide CON.
New York State is a home rule state, and so it's at the jurisdiction of the city, village, town level.
Essex also received a very large significant grant supplement and helped them fill some needs during the day when they're short-staffed. So they have the money to seed it, start it, buy the equipment, the staffing out there, but they don't have the money to sustain it. So that's why they went to see if the county can then tax to sustain the system.
Okay.
Under safety, they talked about revising equipment standards, so we no longer particularly need 24 4x4s and on and on and on. That'll be coming out. And one of the things they did talk about, emergency vehicle operations policy 00-13 is under revision to include driver fatigue as a part of a safety standard. Let's see. They did talk about the workforce survey. If you guys remember seeing the workforce survey from the state, they did start to crunch some numbers on that. They got some really good responses from around the state. More than 50% of agencies replied. Volunteers, hybrids, paid, which were commercial and or municipal. Some urban, some rural. And they got replies from 16 of the 18 regions around the state. And I'll just gloss over some of the numbers. This should be no surprise to anybody that there's a 50%, this is generally speaking on the volunteer level, a 50% decrease in volunteers in agencies. Among paid staff, there's been an increase of delayed responses by 10%. That same amount goes up to 24% for volunteer agencies. That there is a 40% of agencies related that they felt that the system was distressed versus being satisfactory or okay. And 62% of agencies thought that there was going to be a problem with the long-term health of their organizations. And so this is really good data, but it's also very subjective data. So these are organizational leaders reporting on this information. So it's information to know we're all sort of there. And they wanted to just throw the caveat out there that that's a look at the system by leaders by this one particular survey. We talked about the community paramedic legislation already, and that is all I got.
That's it?
Good report. Thanks, Dave. But a lot of stuff goes on in the state, so you're trying to pull it back and how it affects us. So try to keep you informed. All right. So old business, transfer of internal funds policy. Nick?
Yeah,
No update?
no update.
All right. Regional faculty nominations, Dave addressed that. Drug shortage, I don't have anybody responsible for that, but anything on that?
There's still short drugs out there.
There's a lot of drugs.
There's
Yeah.
a lot of, it's a big
All right.
list.
Awards Committee, a written policy and procedure.
I'm sorry, can we go back to the drug shortage?
Yes.
I do want to say that the REMAC is on top of that. And so whenever there is an issue or a problem, the REMAC is very responsive to make sure that we have something in place that we can use as an alternative until, we sort of get whatever medication is back. So I just want to throw out some kudos to our REMAC for their responsiveness in those cases.
Nobody appears to know what the Awards Committee written policy and procedure.
Karen was going to try to work with Kim and to come up with what a policy and procedure so that we can do it the same way each year.
So Karen.
She reached out to me, she didn't get me, I'm sorry.
All right.
Just one thing on that, just remember, we're going into October soon, and usually the awards are for something that occurred this year, so you might want to start jotting some notes, because every year we might have to leave last minute, and nobody has anybody to submit, nobody wants to take the time to submit. You could submit them now, you could submit them January 1st. Do the same form every year,
Yep.
same categories, because we need to have, it would be nice to have a position, an applicant from each county for each position. We don't get that. In some cases, we haven't gotten any in the category, that's it.
Yeah, we do not do, and it's not just the region, the counties do not do a good job of nominations. And I'm sure people are out there doing stuff, and like Kim said, when you see it, write it up, because if you wait till we start pushing out the applications,
And it's the same with
then
the
it's
state
too
level,
late.
it's said,
Yeah.
because most of the regions don't submit to the state. And the guys that are from Rockland know that I chase them, beat them up to submission to give me somebody.
Yeah.
So we recognize somebody. Again, it doesn't cost anything.
Yep. And it all starts at the county level. All right, got a note expiring delegates for, and alternates for Sullivan County, and nobody's here from Sullivan County? One, okay. And you can get with them and get them updated? All right. Any new business? Any other new business besides the Transportation Committee? David?
I'd just like to say, if everyone could really take this information back to their counties and to their agencies, for the county meetings, this stuff really needs to go out. We need to get a little bit more happening at the county level for those agencies to know what's going on in their counties respectively, and then to get to hear. We really need voices. If we don't have voices, then we don't have action. And so that's really, really important.
Just to, again, to go back to the mutual aid, if you look at 1206, if you can follow it all the way down, it's multiple pages. The last 3 pages are actually a template how you fill in. And not only for the state, because they're preaching it now, but how we found out was one of our agencies, when we had one of the storms, wanted to apply for FEMA funding. FEMA did not want to give them the funding, actually they wanted to get it back to them, because they weren't participating in a mutual aid fund. It happened to be one of my agencies that didn't want to play with everybody else. He didn't want to sign on to play without everybody else had signed on to. So they almost got a big fine and had to return that money. Not that I wish anybody even needed to apply for FEMA funding, but if you can get it in place. And again, the template's there.
Yep.
It doesn't create a whole bunch of things. You just have to follow it down, let the agency fill it out, and they send it to the coordinator, and the coordinator sends it to the region. Each person signs off and goes along. It's really not that hard.
Okay, no other new business? All right, for Transportation Committee, we have 2 actions, and I need to read this. All right, conflict of interest. No officer or member of the council may vote on any matter in which he or she has a pecuniary interest. When an officer or member of the council is uncertain as to whether a conflict of interest exists, he or she shall disclose the matter to the full council, which shall decide whether a conflict of interest exists. Tonight, we are looking at the permanent ALS first response operating certificate for Arlington. Is there anybody that has a conflict of interest that they wish to declare for the Arlington expansion?
Which one was that again?
Yeah.
Yes, well, hey.
All right? Does anybody have a concern with that? All right, you will abstain?
Correct.
Okay? All right, so let's get that one off the table. Go.
Okay, the Transportation Committee has a second motion to recommend that the permanent ALS first responding operating certificate be accepted for the Arlington Fire District based on the hearing officer's report.
So we have a seconded motion. Is there any discussion on that motion? If not, this is a roll call vote. And it's a positive motion to accept, so a vote in the affirmative is to accept the recommendation.
Okay, Nicholas Trio, yes. Joan Siebert,
Yes.
Dee Sagendorf. Ben Conquest,
Yes.
Dave Grass,
Yes.
let's see, Michael Bigg.
He left.
Is that- Okay. Robert Cuomo,
Yes.
Matthew Bondi,
This one,
Kim Lippis,
Yes.
Tim.
Nick Brusieski,
Yes.
Tim Egan,
Yes.
PK.
Glenn Alvin.
Yes.
Five.
Let's see, Teresa Hamilton.
Yes.
Okay. Neil Meta,
Yes.
Richard Parrish,
Yes.
Kelly Nelson, Dorothy Balin.
Yes.
Oops.
Yes.
Yeah, I got
We
it.
got
1, 2, 3, 4, 5, 6, 7. 16 yes votes and 1 abstention.
We needed 14
Quorum's 13, we need 13.
there. Need 13.
Okay.
Okay, so the motion carries. All right, for the second one, for the permanent operating certificate, Town of Patterson, same thing, all right? No officer or member of the council may vote on any matter in which he or she has a pecuniary interest. When an officer or member of the council is uncertain as to whether a conflict of interest exists, he or she shall disclose the matter to the full council, which shall decide whether a conflict of interest exists. Is there any conflict of interest to be declared? Seeing none? Go.
Okay, again, this is a vote, a second in motion for the permanent BLS operating certificate for the town of Patterson EMS. The hearing officer voted in the affirmative, and we'll all receive a copy.
Any discussion?
Second in motion. Any discussion on it? If not, roll call vote.
Okay, Nicholas Trio, yes. Dave Violante,
Yes.
Joan Siebert,
Yes.
Dee Sagendorf,
Yes.
Ben Conquest,
Yes.
David Grass,
Yes.
Michael Bigg. He left, I'm sorry. Robert Cuomo,
Yes.
Matthew Bondi,
Yes.
Kim Lippis,
Yes.
Nick Brusieski,
Yes.
Tim Egan,
Yes.
Glenn Alvin,
Yes.
Teresa Hamilton,
Yes.
Sullivan County, Neil Meta,
Yes.
Ulster, Richard Parrish,
Yes.
Kelly Nelson. Yes.
Dorothy Balin.
Yes.
Okay. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16,
17 yes votes, no no votes, no abstentions.
Okay, motion passes. All right, the New Windsor expansion into the town of Cornwall has been appealed, so that expansion is on hold until the Article 78 hearing takes place. All right, we have submitted to them all our paperwork, and what usually happens with the Article 78 is that they'll assign a law judge. He goes through all the information and comes back with an opinion. That opinion goes to the state CMAC and then to HVREMSCO for either supporting that finding or rejecting it, and it could come back here if they find that we missed something. So it could be affirmed, denied, or sent back to us for action. Yes, sir.
Is that not?
I'm sorry, you stand up
Oh, sure.
and identify.
Oh, that one.
Sorry.
Oh, I'm sorry.
Matt. Okay.
I was just curious who appealed that.
Can we say it? All right, it's public knowledge. Mobile Life appealed it. Okay. All right. So again, we'll wait to see what happens, and then we'll take it from there if it comes back here. All right. Any? Yes, Dave.
As a representative for Arlington Fire, I'd like to say thank you all very much, and continue to do the work that we do.
Glenn.
Motion to adjourn.
Why you want to do that?
Second.
Too late.
Yeah, I know. Once a motion to adjourn hits the floor, it's an undebatable motion. All in favor? Then now you can go. Thanks, folks. Hey.